Welcome to the Where Parents Talk podcast. We help grow better parents through science, evidence, and the lived experience of other parents. Learn how to better navigate the mental and physical health of your tween, teen, or young adult through proven, expert advice. Here's your host, Lianne Castelino.
Welcome to Where Parents Talk. My name is Lianne Castelino. Our guest today is a clinician, researcher, and professor. Dr. Robert Melillo is an internationally recognized expert in brain development and neurological disorders affecting children and adults. He's also a best-selling author and founder of the Melillo method, which connects brain function and behavior and overall health without medication. Dr. Melillo has helped children and families struggling with ADHD, autism, OCD, anxiety, and other developmental challenges for over 30 years. And he's also a father of 3 adult children. Dr. Melillo joins us today from New York City. Thank you so much for taking the time.
Oh, thank you. It's really a pleasure to be here. Thank you.
This is a large topic. This is a topic that affects many families. And I wonder if you would start by setting the table for us in terms of what are you seeing in your practice with respect to the number of families who have children with special needs?
Yeah, I think, and we've been hearing a lot about this, I think, in the news of late, that there is actually this essentially epidemic rise of childhood neurodevelopmental disorders that really started about 30 years ago. Around the early 80s is when we started seeing a lot of these rises of these issues. And it's only been really accelerating. And it involves, all different types of neurodevelopmental issues. And because it's been going on for 30 years, we've kind of also see it on the adult mental health side, that it's really all interrelated. But there's, clearly an increase in the number of individuals and number of children that are being born and that have a diagnosis of a disability. It's not just because we're recognizing it earlier or we're diagnosing it better or because of diagnostic substitution. All of those things are part of the increase, and all of that is happening. But really, the statistics show that only about 50% of the increase that we've seen, for instance, from 30 years ago, autism was 1 in 10,000, where now it's 1 in 31 as of last week. If you look at that increase, only about 50% of that increase at most could be attributed to better recognition, early diagnosis, diagnostic substitution, or any of those factors. That means that 50% or more of that increase is unexplained by any of that. And that means that we have to assume that means that that's an actual increase in the number of people. And so, we do see this rise, and it is increasing, and it's becoming more and more and more each year.
Now, you have been in this space over the course of that time. We're talking about 30 years and a little bit more. Can you tell us what first inspired you to go down the road of childhood neurodevelopment?
Yeah, initially, I as a clinician, I was just very interested in neurology and in the brain and in rehabilitation. So I wanted to combine rehabilitation and neurology in a way to, kind of create like this way of using almost like exercises to help train the brain and to do things to help people with those types of issues. And I was initially working mostly with teens or adults. But my own child was diagnosed with ADHD at a certain point, my oldest son. And I was already teaching clinical neurology because I had gotten a subspecialty in neurology and rehabilitation, and I was teaching it and doing research in that area. And so I knew a lot about the brain. I knew a lot about neurology. And when my son was diagnosed, my first question in my head was, well, what is that? I mean, I didn't know what ADHD was. But my first thought, well, what's happening in the brain? And I went out to people and tried to ask them that I thought would know, other colleagues of mine that work with children, and no one could answer that question. And so I realized I needed to kind of look into it myself. I felt that there had to be an answer, but no one was really clear on to what that was. And so that's where I spent, the better part of 10 years really researching it continuously. Eventually, I put it into a textbook called Neurobehavioral Disorders of Childhood and Evolutionary Perspective, which is, it's still a best-selling book today. And we're actually working on the second edition of it 20 years later. But that really, then from there, it was, how do we change it? Like, what do we now, once understanding what the problem was, as I was doing that, I was also looking at different ways to intervene and help my own son and other children. And along the way, I developed, methods that were really very, very effective. And I've just been working on that and trying to perfect that ever since.
A lot of what you've done then is really rooted in understanding the imbalance in the brain, what causes that. So can you take us through what a functional developmental imbalance in the brain is, and how does that impact a child's daily behavior or their learning?
Yeah. Well, when when my son had the issue and when I started looking at it, first I wanted to understand what it was, like, where did these symptoms come from? And one of the things I came across early on in the research was this concept of unevenness of skills. Meant that kids with ADHD or other neurodevelopmental disorders like autism or Tourette's or, dyslexia, that they weren't delayed or behind in everything. In fact, they were often exceptional at certain things, that they were really good at certain things and then struggled with others. So right from the beginning, with a rehab mentality, right from the beginning, that sounded like some sort of imbalance to me, right? That's kind of how I thought about it. And because in rehab, a lot of what we're trying to do in physical rehab is establish balance in the body. And so I started looking into it and really understood that basically in ADHD, everything that they struggled in was a right hemisphere function, and everything that they were exceptional or overactive in was really a left hemisphere function. So right from the beginning, I started looking at that and saying, wow, this seems to fit this pattern. And then I started looking at everything. And then once I kind of figured out that was where a lot of the symptoms were coming from, then I wanted to know what started it all? Where did it come from? And it really went back to brain development. And then a lot of this really has fueled me into doing other degrees. I have a degree in neuropsychology and clinical rehabilitation neuropsychology. I have a PhD in developmental cognitive neuroscience. I wanted to really understand development of the brain at the highest level, to understand what could go wrong, to understand what can we do to change it, right? Because if you really don't know what the problem is, you can't really say what causes it, and you can't really say what you're going to do to change it. So essentially, the human brain is unique in that our brain is the largest brain per body size of any primate, but because we stand upright, we have the smallest birth canal. So our brain has to be very restricted in the womb. We have to not let it grow too much. And so when a human brain is born, it's very immature. It's only about 20%, 25% of the adult size. Every other animal has most of their brain developed in the womb. And they're much more further along in their maturity than we are. It means 75, 80% of our brain development happens outside the womb. And that's the most important part of our development. So anything that alters that developmental trajectory, if we don't hit those milestones that we're supposed to hit, if we're late or if they're off or if we skip them, it really signifies that something is affecting the way our brain is growing, and that when we go off in one direction in a way, it will continue. And the right hemisphere takes the lead in development in the first 3 years, and then the left brain comes on for the next 3 years. And at the end of 6 years, our brain should be pretty balanced and integrated. And then it should develop from there. And the right and left brain should be very different from one another. So anything that alters that growth and development can create this imbalance where the left brain may come online too early and stop right brain development, or the right brain may stay on too long and interfere with left brain development. And that creates this imbalance, this developmental imbalance in the brain. And we get overactivity of certain networks on one side and underdevelopment and underactivity of the other. And that's really where all the symptoms end up coming from.
So how does a parent then, detect, how does it manifest a brain imbalance in a child before they are formally diagnosed?
Yeah. Well, one of the things is really paying attention to those milestones. Today, it's really common for pediatricians and people to say, well, it doesn't matter. All children develop at their own way. And, crawling isn't even a milestone anymore. It's completely wrong. And it just clearly shows that they don't really understand how the human brain develops. But we know that looking at those milestones, even before birth, one of my main areas of research is something called primitive reflexes or neonatal reflexes. These are these motor reflexes that we're born with that are there even before we're born. And because our brain is so immature at birth, we need to be able to move, to be able to engage the world around us, to stimulate the senses and stimulate the genes that will build our brain. And we need to be able to move. But the part of our brain that really allows us to move isn't really developed yet. A horse will run in under 2 hours after being born, right? Humans, in the best case scenario, won't walk until around 12 months. So there's a big delay in our motor development, but we need to move. So we're born with these things called primitive reflexes from our brainstem that allow us to move and do things like suck and root so we can feed ourselves. But also they allow us in the womb to be able to get into the right position. A baby at the end of the third trimester should get into the right position, upside down and backwards, and do it without the cord getting wrapped around their neck. And they should be deep enough down in the birth canal that it induces the birth process. And if that's not happening, or if there's a delay or the child is breech or the cord is wrapped around their neck, you have to ask the question why. That's not the way it's supposed to be. And I believe that that's because these reflexes aren't really there when they're supposed to. They're delayed in their appearance, and the movements are not happening the way they should at the time they should. And then baby should use these reflexes to help themselves move down the birth canal and get themselves out. If there's a forceps needed, if vacuum extraction, if the child needs extra assistance to get out, again, it may tell us these reflexes aren't there. If a baby, the first milestone outside the womb is a child should be able to latch on nice and properly to breastfeed if the mother chooses to do that. And, we see 85, 90% of the kids, especially the non-speaking autistic kids, could not latch on. Why? Because usually that rooting and sucking reflex isn't there when it's supposed to be. And then if they miss that milestone, they usually miss other milestones or skip them or do it in an unusual way or drag one leg or scoot on their butt or do an unusual crawl or skip crawling. They should go through all these stages. And at right around 12 months, all children should be able to say a few words. They should be able to point clearly and have eye contact, and they should be walking. And if they're not, then why? And what we've been able to show with our research is that if these reflexes don't come on and they miss these milestones, then these reflexes are supposed to go away at 1. They lead us through that first year, but then they need to go away. Otherwise, they keep the brain in a more immature state. And then this can lead to these imbalances. And so for me, looking at those early milestones and looking at even those pre-birth movements and looking at what's happening at 1 and even if a child is doing that, they should never regress, right? So we know that some children seem to be meeting their milestones, even though they usually don't really, but they might be able to walk or talk a bit or point. And then in the next, 6 months or a year, they lose that suddenly or it gradually just goes away. this is, again, the emergence of this imbalance where we see that left brain comes online too early and it pushes down that right brain. And that's where we see a lot of that regression happening, where a child will lose a lot of those skills. And again, we see that those reflexes are still there. And that's really one of the root issues.
So when you talk about hemispheric brain imbalances, firstly, how many of these conditions that we've kind of briefly alluded to, ADHD, autism, OCD, etc., can be directly attributed to these brain imbalances? And then the second part of the question is, what can be done to restore the balance? And is that even possible?
Yeah. All of them are due to that. Basically, everything we see. Now, again, there are children that have brain injuries. There are children that have genetic disorders like Down syndrome, Fragile X, tuberous sclerosis, Landau-Kleffner syndrome. And then there are what we call de novo mutations that we don't really have a name for, that really show up in the child and aren't present in the adults. Those are very rare. When we look at autism, for instance, we know that there are some kids that are what we call syndromic. So that means about 5, maybe 10% of kids that are labeled with autism really have a genetic mutation somewhere, like Down syndrome or Fragile X, and they also have features of autism. But 95 or 90% don't have any of those. They don't. So what we're dealing with are children that don't have any clear-cut genetic mutation. They don't have any injury, and yet they have these pretty severe developmental issues or delays. They're not speaking, or they're not looking, or they're not pointing, or they may have a lot of immune issues going on. So all of those are essentially a different type of these imbalances. This root cause is this imbalance, this delay, this developmental delay. And depending on the natural genetic traits of the child, like for instance, we know in autism, Simon Baron-Cohen, one of the top researchers out of Cambridge in the 90s, showed that in the families of people with autism, there were a lot more physicists and mathematicians and engineers. He also showed that there was a lot more people in the finance world or professional doctors, lawyers, and then also showed that anywhere where there was a cluster of people that work in the IT industry, like in Silicon Valley, you have a very high rate of autism in those areas. So what does that all have to do? What do those jobs all have in common? They all have basically left brain skills, right? People that are uniquely gifted in their left brain abilities. Whereas something like bipolar or dyslexia, we know that these are people that have right brain skills, people that are more gifted, let's say creatively or socially or athletically. They're more likely to have children that have dyslexia or bipolar or learning disabilities or processing disorders, things that are left brain delays. So it's all of these things are superimposed on traits and other features, but essentially they're all part of the same thing. They're these functional disconnections between networks. The way to change it, the good news is, again, because there is no genetic mutation and there's no brain injury, we can change it. We can, in many cases, completely correct it. And obviously, the earlier, the better, but it's never really too late to also. And the brain has something called neuroplasticity, which means it can change dramatically with the right type of stimulation. So it starts with an evaluation and an assessment to really identify the nature of the imbalance and where it is, and whether it's more of right hemisphere networks or left hemisphere deficit, and then we put together a program that is really comprehensive, because the brain controls everything. So we do first we want to address these primitive reflexes, because that's what's end up holding the brain back. So we need to kind of unleash the brain and get rid of that. So there are different ways of stimulating the reflexes and bringing them out and bringing them on so that they will go away. And then there are also exercises that we do to allow the child to be able to move their body in more complex ways and improve motor coordination and balance and muscle tone. And this helps to literally help them create maps in their brain of where their body is and how to move their body and how to feel their body and how to control their body. And then that allows them to get more in touch with their emotions and read them on other people so that they can socialize in a more normal and typical way. It may help them to be able to speak or be able to understand or be able to read better. But then we need to target specific cognitive skills in one side or the other. We also look at diet and nutrition because this is often impacted, even though it isn't the source of the problem. Many people hear about things like leaky gut or inflammation or neuroinflammation, and all of that is a part, but it's not the root cause. That's a secondary byproduct of this developmental delay and imbalance in the brain. So there's a lot of different things that we can do to be able to correct this imbalance.
So from what you just said, it sounds like a holistic approach in terms of the treatment method, but it does not involve medication. So what do you say to parents who may be listening to or watching this interview who say, I've gone far down a road where I was prescribed A, B, C, and D for my child. It has made things worse. It's made things better, whatever. That now they're hearing you say that medication is not necessary and that essentially the root cause probably hasn't been dealt with effectively if medication's being used.
Yeah, and I think I'm not, again, we're not against medication. Many of the children, if not most of them, and adults that we work with come in and they're on medication. And that medication may be helpful to manage their symptoms. But I think everybody realizes it. Nobody's out there saying that, medication is the cure for ADHD or for OCD, or it is helpful for managing symptoms, but it's not addressing the root problem. And so I think what everybody would want is the root solution. And if we can deal with that effectively, then the medication doesn't become necessary anymore. So it may be helpful. And in some kids, like for instance, kids with ADHD, when they have something like Ritalin, if they really significantly do better, that is almost a clear indication that there's a right hemisphere delay, right? So diagnostically, it has some benefit. But even the largest study ever done on Ritalin in ADHD, which is one of the largest studies ever done on medication, was a 20-year study, showed that the medication was only effective really within the first 14 months. And then after that, the effectiveness went down. And again, they looked at a study with hundreds of kids using Ritalin and not using Ritalin, all with ADHD. And it showed that after 20 years that there was no difference, that basically there was no benefit to the medication, meaning those kids didn't do better in school or, function better or, weren't emotionally better. There wasn't any significant difference in the symptoms. The only thing was that medication, the kids that were medicated tended to be shorter on average. And that was the only difference. So it doesn't have any long-term change or benefit. I mean, that's pretty clear. And so it's not that medication is bad or anything like that. It's not addressing the core problem. If it helps manage symptoms, and it might even help us as we're working with the child initially to help us manage them better in the treatment process so we can get them to do things that they may not be able to do if they're so hyperactive or so super OCD. But the idea is that if we're addressing the core issue, that they may not need medication down the road. And that's what we see the majority of the time.
In the time that you discovered your son may have ADHD, in the time you've been researching and digging and poring over all this information over the last 3 decades, the evolution and advancements in brain science have been quite profound. What would you say has been the biggest advancement in terms of how it relates to what you do and the treatment and the patients that you treat?
Yeah, in the 90s, Bill Clinton declared the 90s the decade of the brain. And all of this brain research really came out in the beginning of the 90s, and it really had started in the late 80s, and a lot of new technology to look at brain imaging in real time. Before that, things like fMRI and SPECT scans and PET scans and really sophisticated EEG or QEEG. It didn't exist. And so we had to assume a lot of things about what was actually happening in the brain. And a lot of the assumption was that there must be like an injury somewhere in the brain or damage or a lesion. Once we were able to really look at the brain in real time, it was apparent that in most of these mental or developmental issues, there wasn't actually any injury or damage in the brain, and that there was a problem with what we call functional connectivity, that the way the brain communicates and connects and the development of networks and the development of the way networks build and the way that they end up interacting and integrating and what they do. And the development of the technology from there, even like in our office now, we'll do what's called a QEEG, where really it's very sophisticated, where we can look at the brain in real time and measure brain waves and actually look at that from a 3D image. And we can do that right in our clinic where, 20 years ago, you couldn't do something like that in that way. And so with that, we've gained a tremendous understanding of the way the brain works, the way it functions, and the nature of these issues. The only problem is that, you have to have a really good understanding of neuroanatomy and functional neuroanatomy, meaning the way the brain works and the way it functions. And there aren't a lot of people out there that really spend a lot of time studying that. And that, some people that really do understand it may do research. Clinicians typically don't understand it that well. So, that's where I've dedicated my life over 30 years, both as a really high level researcher, but also as a clinician, to really merge those things together. And now a lot of the information that we're getting really is new information on how the immune system and the autonomic system and the brain work together. And this kind of neuroimmunology piece, which is a really big thing. Understanding that and understanding the way it works. So I think that's really the biggest advancements, but being able to then turn that into some sort of clinical program. What does that mean for a patient? How do they present? And then what can we do to change it? And how can we measure it? What we do and what I've taught and developed is something called functional neuroscience or functional neurology, meaning that we want to measure these functions. We're not just looking to manage symptoms. We're not just looking to manage behaviors. We're looking to address the core issue and understanding the root problem. And I think right now, our lab and what we do, we're at the forefront of that we understand it better than almost anybody, and really have turned it into clinical solutions to really impact people now.
One of the things you mentioned there certainly are the patients that you see every day. And at a very granular level, we're talking about special needs and conditions that can tear families apart, tear couples apart, completely undermine family life because they're searching for answers that they may not have received on their child. What would you say to a family in that situation who has maybe gone down a road or maybe just starting on the road in terms of what should be their next step?
You put that in a way that I don't think anybody's ever put it before, but it made so much sense. You said that they're being torn apart because they're searching for answers that they're not getting. And, you're so right about that, actually. That is really a big issue about what's going on. I'm sorry about that. But you're right, like 85% of families with a kid with autism end in divorce. And a lot of it is because, it's very difficult. And the parents themselves really go through a lot of trauma. And really, they're not getting anybody explaining anything to them. The first question I ask anybody, and we see people from all over the world on any given day. Like I had my first 3 people today were from Serbia, Italy, and from Brazil, right? They come here from all over the world. And the reason why they do that is they're not getting any answers where they come from. And the first question I ask them is, has anybody tried to explain to you what's happening in your child's brain? And the answer is always no. They didn't say anything about that. And then I usually ask them, why do you think that is? And they're smart enough to know that they say, well, they probably don't know what the problem is. And I said, that's right. So if you don't know what the problem is, you really don't really know what to do about it either. And so, I think that trying to give them real answers is really important, because when they're not getting answers and it just fuels frustration, it does nothing to change it. Again, they're just trying to manage things, and it's difficult, and and it's expensive. Obviously, any treatment, especially the most innovative treatments, are very expensive, and it puts a lot of strain on the family and on the marriage, and it's very difficult. So for me, that's why searching for the real answers and being able to relate that to people. That's why I've written books. That's why Disconnected Kids, my book is in its third edition now, and it's one of the best-selling books of all time in this genre, and has been translated into 18 languages, because it's directed towards explaining to the parent what is happening and putting the tools of how to change it in their hands. So you say to me, what's the first thing they should do? They should get that book. And I don't want to sound like it's self-promotional, but I'm just saying that it is really, I think, the best book that's been written that explains what's actually happening in the child brain, gives the parent the ability to assess their own child, and actually gives them tools to start to make a change in their house right away in a comprehensive way. And we get people, the reason why the book is so popular is because some people just use the book alone and get great results. So for me, really understanding what the problem is, getting the answers that they're searching for, and maybe diminishing some of that frustration and anger, and being able to focus it on some hope and give people some hope, because that's what, most people, it's just really taken away from them right from the beginning. They're told there's nothing you're going to be able to do about this. Just start looking for an institution or a home for your child, which is horrible.
We only have a couple of minutes left, but I did want to ask you if you could paint a picture for us in terms of the outcomes and the improvements that you have seen with your patients over the years, the children in particular, who have completed your program.
Yeah. Well, there's two situations. One is we have the actual research that we've published. So we have published that where we've done experimental research. I have done basically the only really large randomized age-match controlled double-blind study looking at retained reflexes in children, adolescents, and adults with autism. And we've been able to show that in even 12 weeks, with the right type of activities, that we've been able to show dramatic changes in brain imaging and in neuropsychological tests, and in the reduction of the reflexes themselves. And that translates into improved behavior, improved language, improved immune function, digestion. We also have outcomes that we produced from my practice and from my centers, where we've shown different outcomes. Like, for instance, one of the first studies we did many years ago was looking at kids with ADHD. And we were able to show that in 3 months, 80% of the kids that were initially diagnosed with behavioral scales of having ADHD, in 12 weeks, they no longer really fit that criteria. So we have outcomes data that's been published. But in my individual practice here, especially, we work with really some of the most complicated issues, and we work with all different age groups. And so, statistically, we're compiling this data, but it's hard to give a general, because there's all different variations and there's many different factors. How well the people are instituting a lot of the home programs or the activities, and the level of the imbalance, the age of the child, what else is going on? Is there any injury in the brain? So there's many different factors, but for the most part, in the vast majority of kids and people that we work with, within, let's say, kids that are non-speaking, usually within the first year, 80% of those kids start to speak at some level. If not, some that were speaking at a lower level really speak at a much more typical level, which is pretty remarkable. We're able to get many of these kids that are not speaking. And that's really the bulk of our patients right now, is really working with and understanding the non-speaking autistic individual. I think it's the most challenging. I think I understand it as well as anybody. And I know that the results we get are better than anything else out there. And, again, in most of those kids, there are dramatic changes, even within the first couple of weeks. I mean, they start feeling their body. They start changing the way they eat. They start, reducing their anger and their frustration and their stimming and ticking behavior. But it takes a while. This isn't going to happen overnight. We're working with these kids for at least a year to really get, some significant changes. But we do get significant changes on almost all of them.
We only have about 30 seconds, but I did want to ask you, you set down this path in large part to address what was happening with your eldest son. How is he doing?
He's doing great. He's actually, again, all my kids had different issues and all of them are uniquely gifted. And that's what I want parents to know, that if a child has an imbalance, it's almost always starts out because they have areas of their brain are stronger than most people. And, my son is a builder and an artist, and his spatial awareness is incredible, his visual spatial skills. So, that's he's doing great.
Dr. Robert Melillo, thank you so much for your time and for your insight today. Author of Disconnected Kids, clinician, and researcher. We really appreciate it.
Thank you.
To learn more about today's podcast guest and topic, as well as other parenting themes, visit whereparentstalk.com.